So let's talk about CAR T cell therapy. CAR T cell therapy is a form of gene therapy where we actually filter out white blood cells from a patient's blood, genetically modify them by introducing a gene into them. That gene converts that beat up, exhausted white blood cell of the patient into a super powerful and potent white blood cell that has the unique ability to identify the myeloma cancer cell, engage it, and kill it instantly. Um, there are commercially available CAR T cell therapy products which have been studied and evaluated in trials and have shown remarkable effectiveness and are found to be very safe as well. One important concept that I would like to talk about is the target for this CAR T cell therapy. BCMA, or B cell maturation antigen, is actually a protein that is expressed on the surface of a myeloma cell. This protein has certain unique characteristics. It is universally expressed on all cancerous myeloma cells. It's actually involved in the growth, proliferation, and survival of these cancer cells. And hence, by the virtue of these traits, it actually becomes a very attractive target for our CAR T cell therapy. Idacaptogene viculocil, also known as ide-cel and known as the brand name Abicma, was the very first CAR T cell therapy that got approved for patients with relapsed refractory myeloma. The pivotal trial that evaluated the role of this CAR T product for patients with relapsed refractory myeloma was known as KarMMa-1 trial. This was a phase 1 trial, and this trial evaluated close to 130 patients with relapsed refractory, heavily pretreated myeloma. Patients on this trial, on average, have received at least 6 prior lines of therapy, with one patient actually having received 16 prior treatments before they received CAR T. At least 1/3 of the patients actually had high-risk mutations, and close to 40% of the patients had extramedullary myeloma, which is considered to be an aggressive disease feature. 85% of the patients were triple-class refractory and were the focus of this trial. After receiving a single one-time infusion of a CAR T product, nearly 75%, which is 3/4 of the patient population, actually had a response. At least 1/3 of these patients had a complete response. And once a response was achieved, it on average lasted for about 12 months. Patients on average lived for about 18 months and beyond after receiving a single one-time infusion of this CAR T product. This eventually led to the commercial approval of this CAR T product as the brand name Abicma in March of 2021. And many patients in the US have actually received this CAR T product for their relapsed refractory myeloma, provided that they have received at least 4 prior lines of therapy and they have had exposure to an anti-CD38 antibody like daratumumab, an immunomodulatory agent like lenalidomide or pomalidomide, and a proteasome inhibitor like bortezomib or carfilzomib. The second CAR T cell therapy product that is actually commercially available now and has been studied in trial is known as ciltacabtagene autoleucel. We like to nickname it cilta-cel. Its brand name is Carvictory. And this particular CAR T product was actually studied in, again, a phase 1 trial known as CARTITUDE-1. This was a trial where close to 100 patients with heavily pretreated relapsed refractory myeloma received a single one-time infusion of this CAR T product. Again, this was a heavily pretreated patient population, where patients on average had received at least 6 prior lines of therapy, with one patient having received 18 prior lines of therapy. 25% of the patients had high-risk mutations, and nearly 15% of the patients had extramedullary myeloma. 90% of the patients were triple-class refractory, were perhaps the focus of this particular trial. So in summary, a heavily pretreated relapsed refractory patient population. When given a single one-time infusion of a CAR T product, 98% of the patients actually had a response, and remarkably, surprisingly, 80% of the patient actually had a complete remission after receiving this CAR T. When evaluating for minimal residual disease negativity, which is a very deep level of remission, 92% of the patients are found to be have no evidence of disease with this specialized test. 2-year follow-up after receiving the CAR T cell therapy product, cilta-cel, 60% of the patients were actually free of relapse. Nearly 75% were actually alive at that time of 2 years. For patients who achieved a complete remission, which is a vast majority, nearly 80% of the patients, essentially all of them were free of disease relapse and were alive at the 2-year follow-up. This groundbreaking, jaw-dropping success of this CAR T cell therapy eventually led to its approval by the FDA in February of 2023, February 2022. And many patients in the US have actually received this treatment since then. Knowing that the effectiveness of these two CAR T products are different, it's not uncommon to see comparisons drawn. But I do want to highlight here that these two CAR T products are different in many different aspects. They have different structure, they have different mechanism. The patients who were actually studied on these trials were not similar. They had different disease levels of aggressiveness, and perhaps it's not fair to actually state that one CAR T product is superior over the other. In my opinion, they are both available as effective options and should be considered in patients who are eligible for them. Looking at some of the safety or side effect profile of this CAR T cell therapy, CRS is a commonly experienced side effect. It essentially means patients spike a fever after receiving CAR T cell therapy, and it can happen in 90% of the patients. In a very small minority of patients, the fever can also be associated with low blood pressure or oxygen requirements, and hence patient need to be in an intensive care unit. Confusion is something that can be seen in 20% of the patients. We like to medically name it as neurotoxicity. And in a very small minority of these patients, this confusion can also be associated with seizures and strokes. One common and perhaps more challenging side effect that I oftentimes see in my patients is low blood counts after CAR T cell therapy. These low blood counts can be seen in as many as 90% of the patients, and they can persist as long as 3 to 6 months. This requires patients to actually have frequent blood draws, blood transfusions, antimicrobials and antivirals given to them. And then nowadays, we are also using already stored and harvested stem cells for rescue of these blood counts for the patients.